Hello and good afternoon. Thank you for attending our webinar. I'm Jessica Miller with Medicodio, and today we're going to discuss solving medical coding industry challenges using AI. Pause for a few minutes and let a couple of our other attendees join the meeting. Get started here shortly. Thank you. Good afternoon for everyone just joining us. We're pausing just a few moments to let a couple of the other attendees in. We'll get started here in just a minute. Good afternoon, everyone. It is now 2 minutes after 12. I am Jessica Miller with Medicodio, and you are attending our presentation on solving medical coding industry challenges using artificial intelligence. Specifically, we're going to discuss today workforce shortage and compliance issues. I appreciate all of you joining us today. During this webinar, you will be in listen-only mode, but we will turn that off at the end for a short Q&A session. So again, thank you for joining us, and I'm ready to get started. So today's webinar is entitled Solving Medical Coding Industry Challenges Using Artificial Intelligence. And this presentation is being presented to you by Medicodio, a technology company creating medical coding agents that enhance the workflow of medical coders. Today, our conversation is going to focus specifically on workforce shortage and compliance issues. So I am Jessica Miller, the presenter for today's webinar. I am the product evangelist for Medicodio, and I have been with the company since its start in 2021. My main role is to ensure the integrity of the code set data, provide feedback on enhancements to our platform, and engage with our customers to ensure the product is meeting their goals for AI implementation. I also have the pleasure of presenting our artificial intelligence agents and other similar technologies at national and local conferences. And I'm glad to be here with you all today, and I'm excited to share some of our insights on how artificial intelligence is enhancing the output of today's medical coders. So today we are going to walk through some of the current challenges faced by the coding industry, specific to workforce and compliance issues. And then we'll look at some of the ways that artificial intelligence is reshaping the workflows in these processes to bring more efficiency and accuracy. So how many in the audience are feeling the pinch of some of the more common challenges that the revenue cycle management industry is facing? Starting with navigating complex code environments and then dealing with challenging payer requirements. We're also tasked with understanding all of the quarterly code set updates, maintaining that updated code reference information for our coding teams. Or you may just be struggling to maintain a full staff load. I saw a trend for several years where coders were behaving much like some nurses do and kind of following the dollar between hospitals or employers. Coupled with increased demand in healthcare services from the pandemic, and a job growth rate that ranks along with the national average, the medical coding industry is really in a pinch for individuals. But not just anyone. We're seeking individuals who are qualified in the specialties that are facing those backlogs. And it's only fitting that we're turning to technology, and specifically artificial intelligence agents, to augment these processes. All the issues mentioned in the previous slide relate to the larger issues of workforce and talent shortages, and coding compliance and accuracy maintenance. Now, when I say workforce and talent issues, I'm speaking specifically to the hiring, retention, and abilities of the current workforce. But really, those are just some of the surface issues. As healthcare professionals, we understand there's a number of factors that play into analyzing workforce needs, and that much of that is out of our control. Underlying factors driving the workforce and talent issues are the reduction in certified coders. I mentioned in my earlier slide that the demand for medical coders is growing, and actually it's faster than the national average, with a 9% job growth rate predicted by 2030. And while the pandemic may have slowed down other industries, the demand for healthcare services actually increased. So of course, coupled with the workforce shortage, we have this backlog of work, cases that are sitting there uncoded, appeals and denials that haven't been worked. All of this leads to burnout in our current teams, as they're trying to manage the excessive workload with their limited resources. And all of this, of course, can lead to inconsistencies and errors in the coding practice. So all of these factors kind of compound on top of each other. And of course, we understand that all of these impact our reimbursement and denial rates, which could come from a misunderstanding in those coding guidelines and coding errors from that burnout. Now, that might sound all doom and gloom, but technology is quickly being developed to tackle these issues. When it comes to hiring qualified individuals and retaining staff, burnout prevention is key. Having the right technology tools can alleviate the manual workload and reduce the performance of non-value-added tasks in the revenue cycle. Artificial intelligence enhanced training modules also help ensure the expertise of a coder, helping them specialize in different areas and providing real-world experience. On the job, artificial intelligence augmented training also allows the coder to gain expertise and clarity in more complex coding guidelines. Seeing code suggestions with logic and rationale deeper the coder's understanding of the decision-making process. And it also alleviates the time-consuming searching for relevant code information or guideline clarifications. Now, if you're already short-staffed, artificial intelligence coding agents can be employed to reduce backlog and enhance the efficiency of existing team members. There are several ways that this can be done, but most commonly is through automated medical coding. This method employs artificial intelligence to review documentation, verify discrepancies, and suggest medical codes as appropriate per the record. Artificial intelligence also helps to analyze workflow, giving guidance on chart urgency and complexity to ensure efficient task management. There's also been great enhancements through artificial intelligence applications in speech-to-text and natural language processing conversions. This streamlines the chart processing and reduces turnaround time. Another plague of the revenue cycle process is consistency. Imagine a world where every office was using the same transcription, EHR, and clearinghouse system. And along with that, there's standardized coding guidelines followed by every payer, regardless of carrier or region. And while we're at it, doctors have developed standard dictation and templates that allow for personalization, but don't have to recreate the wheel each time. Alas, until such a day, we can rely on artificial intelligence to bring some standardization, at least as it relates to maintaining that compliance and updated code data sets. Artificial intelligence technology can assist coders in ensuring code accuracy by cross-checking coding guidelines and documentation requirements. And employing artificial intelligence technology to automatically update code sets ensures real-time integration of any changes. Another challenge common to medical coding and revenue cycle management is maintaining code accuracy and compliance to standard and payer-specific coding guidelines. When it comes to code accuracy, we're looking at issues like not coding the highest level of specificity, maybe due to a lack of documentation or understanding. There's also over and under coding, which can disrupt reimbursement. Utilizing artificial intelligence agents to review every record ensures that coding isn't performed from rote memory or charge master billing. Artificial intelligence agents also help coders navigate complex modifier requirements and ensure facilities aren't missing out on reimbursement due to improper usage. So a couple of these have obviously discussed where these can be used as augmentation tools. And ultimately, the goal of the artificial intelligence is to augment and bring efficiency in those processes. We're still relying on the human individual to have the subject matter expertise to verify the coding and billing and to train the artificial intelligence engines. But there's a lot of opportunity to introduce these AI agents in the medical coding process to ensure that we are getting the compliance and accuracy that we require, as well as being able to do so without putting more workload on our current team members. So AI coding agents can address some of these issues through several main functions. I touched on a few a moment ago, but specifically with artificial intelligence-driven code suggestions, the coders get code suggestions and can use their expertise to apply any of those rule-based edits, significantly reducing the time spent searching and selecting codes. And natural language processing has been a game changer for developing these agents, with several companies employing them to analyze physician notes and recommend the most precise codes. Now, again, this is just a natural language process function where it's based on a point-and-click selection. We're still going to need to apply the additional artificial intelligence agent logic to interpret the code guidelines, apply NCCI edits, verify first listed diagnosis, and all of the various rule-based code guidelines. But through this analysis, artificial intelligence agents can also flag discrepancies or omissions in the documentation that could impact code selection. So along with being able to identify a specific coding that's relevant in the documentation, it can also analyze where there might be gaps or things that are missed in the documentation to provide a more accurate code suggestion. For ensuring that accurate code selection and adherence to coding guidelines, technology can bring a greater understanding to the coding team. Artificial intelligence agents detect patterns in coding behavior, which may help flag repetitious behavior. It may also help identify inconsistencies in documentation. And all of this can be used to educate your team members and your physicians on better documentation and coding practices. Artificial intelligence can also quickly analyze suggested codes as compared to bill codes and help identify those clinical documentation improvement initiatives. So while the engines are ultimately designed to provide the most appropriate code per the record, they're also providing additional information, that gives that coder a resource to understand if they're making the most appropriate code suggestion and if those guidelines are being applied appropriately. Doing so system-wide allows for that consistency and ensures that all of the coders are following the same coding guidelines. Artificial intelligence agents also help reduce coding errors by providing the first audit of the coding and code application guidelines. Artificial intelligence agents help coders determine appropriate editing through automatic NCCI edit verifications. And in some instances, the agent can also suggest the appropriate modifier for overriding that edit. Coders get intelligent suggestions about which codes and modifiers are appropriate based on standard or customized rules. And having this pre-audit of the chart reduces denials by ensuring correct coding initiatives are met before claims are submitted. Lastly, artificial intelligence agents employ automatic processes to ensure regular updating and maintenance of the code sets. Maintaining an accurate code set is integral to correct coding. Automatic ingestion of the updates means they can be accessed immediately by the coding teams. The updates can then be incorporated into training modules, ensuring correct assimilation of the new information into the knowledge base. Artificial intelligence agents can also assist with review of historical billing and provide an analysis on previous coded claims to ensure they align with the latest coding updates. Mention briefly that artificial intelligence agents are also being employed in document review. Artificial intelligence agents can quickly analyze a chart and identify those documentation gaps that impact code selection. They also reduce the manual workload for generating and submitting queries, providing customized query forms to request updated documentation. This streamlines the query process and ensures the updated documentation can be easily tracked to completion. Artificial intelligence advancements have also brought consistency into the documentation processes. By utilizing artificial intelligence to convert text-free notes into structured data for more precise analysis and coding. So now that we've ingested the information regarding what AI can offer as a solution to workforce and compliance issues in medical coding, let's dive deeper into some specific technology developed by Medicodio to revolutionize artificial intelligence medical coding agents. So at Medicodio, we've developed artificial intelligence coding agents to save you valuable time and financial resources, reducing the need for extensive training and human turnaround while maintaining accuracy and quality in medical coding. Our vision is to revolutionize the future of medical coding by enabling faster, smarter, and more accurate coding processes. We're going to empower healthcare organizations, helping them improve efficiency, reduce costs, and enhance the quality of patient care through implementation of our AI agents. Our focus is on augmenting the processes and ensuring we're bringing efficiency and accuracy, not necessarily looking for technology to replace, because automation still requires training and individuals for oversight and quality control. Some of the benefits of introducing an AI-powered medical coding agent are the AI-powered accuracy you receive. We reduce coding errors and ensure compliance by adherence to the latest guidelines. And those are done through automated updates of the code sets and direct integration into our platform. Also have faster turnaround. We're automating those time-consuming tasks to deliver your results more quickly. Cost savings are brought as we minimize the need for intensive training and manual intervention from a human workforce. We bring improved productivity because we allow the coders to work smarter, not harder. They're given those pre-populated code suggestions, have the references for their code selections right at their fingertips within the platform, and can easily navigate about to make their code selection and verify coding guidelines. We also bring seamless integration. We easily integrate with your existing systems to fit into your workflow. No need to have additional resources. We provide RPA and API technology and integrations so that we can streamline the push and pull of data between systems. By streamlining these back-end processes, your organizations can devote more time and resources to patient care. So what sets our Medicodio coding agents apart? Well, Medicodio is a team of technology experts, medical coders, and designers that were committed to improving the accuracy and efficiency of the medical coding workflow. We wanted to take all the best parts of artificial intelligence technology, like machine learning, RPA, and add our additional proprietary knowledge base so that unlike other coding software, we're more than just a code reference tool. Our enhanced AI agent solution is designed to anticipate your coding needs by analyzing the patient charts and demographic information. We are customizable to your facility setting and have the available code sets to provide coding regardless of the specialty. Our agents work through automating the processes and reducing the manual workload for your individual coders by extracting the patient chart data from the EHR, either through our RPA or API integration channels. Our platform intakes the documentation information, verifies all of the appropriate references for extracting and providing a suggested code, can help identify, as I mentioned, those documentation deficiencies or gaps where additional information may be required. It has various dashboard settings to allow you to see the health of those cases as they navigate through the system. So as the agent analyzes the documentation, it's able to suggest the medical codes, CPTs, ICDs, HCPCS, or modifiers as appropriate for the setting or specialty for the chart type being reviewed. Those suggestions are presented, and depending on the workflow, they will require the review of a medical coder. The AI agent will give out the medical codes, and then the interaction with the subject matter expert verifies the claim data before it's pushed back to your billing system. So the selected code data is exported to the claims, to the billing system via our API or RPA integration, again, reducing the manual workflow and streamlining the process of the chart coding directly into the EHR system. Accuracy improvement and enhancements are obtained through direct user feedback. So along with having direct interaction with the engine and being able to see and manipulate the code results, coder users can also improve the accuracy of those code suggestions through their interaction with the platform. Now, specific features of our Codio AI agents are that we are compatible with any EHR system. We're utilizing those RPA and API technologies to push and pull the chart and coding data, and we're able to do so regardless of the platform being used within the facility. We do maintain the complete code sets, so our coding module is applicable across various specialties. We can intake charts of all different specialty types from all different provider types and location settings, and we are able to aggregate and provide the appropriate coding based on those places of service. Comprehensive code set library is based off of our knowledge base, and coder users have direct access to all the relevant code information. So for CPTs, we're getting descriptions, assist notes. For ICDs, we have our excludes and includes. They're able to see first listed guidelines. So essentially giving the coder access to the rationale for those code suggestions and allowing them to see even deeper in and provide understanding of the reason for that code selection. We've also automated non-value-added functions of checking for NCCI edits, as well as verification of LCD and NCD documentation. So these features are automatically provided for the coder user, and they simply provide their subject matter expertise to verify if any additional actions would be necessary based on that information. Our agents also provide in-depth reporting dashboards with customizable options, allowing you to control what you see and the overall face of your platform. You can also manipulate different data points for analysis. So we can show you utilization across specialties or settings. We also have health of the charts in the system, so you can come and see exactly how many might need clinical documentation improvement, those that are ready for coding, productivity by coder for completed charts. So spend a significant amount of time making sure that our interface is user-friendly. We're wanting to reduce, again, any of that manual or inefficient processes. So a lot of our platform is based on point and click or quick search of the data. And all of this, again, the function being to reduce the manual workload of the coder and allow them to really apply their expertise in finalizing those code selections. We provide our solutions in two processes. Our AI agents are available as co-pilot or autopilot functions. Our co-pilot AI agent offers the code suggestions aligned with the documentation. And then our coders utilize the software to complete and finalize the claim details. So they get direct interaction with the platform in verifying the code information generated by the AI agent. This streamlines their workflows and speeds up the code selection processes by giving them a leg up on what might be possible for potential code suggestions on complex cases or things requiring additional verification. Autopilot agent is for those cases that are ripe for automation and where the agent can actually select the appropriate coding based on the documentation provided. The coder provides the approval for the claim output, and the information is then automatically generated back into the EHR billing system. So this is reducing your coding turnaround time, since the artificial intelligence agent is actually performing the functions of the code selection and application to the claim. This also enhances the accuracy of the codes and avoids downcoding by having that additional audit review of the AI engine selections. Our clients experience enhanced efficiency and greater code accuracy through our AI agents by seeing a significant reduction in time spent on tedious data entry, thanks to RPA and API integration. Coders simply review and approve the suggested codes presented by the engine. They're able to learn new specialties or understand more complex cases easily by verifying the rationale from the AI agent. We're also reducing the learning curve required for EHR, EMR, practice management systems. Coder users can perform all of their coding functions directly within our platform, reducing the need to navigate to the EHR system to verify other information. We're able to ingest the patient demographics along with the chart information, and then we automate the process for pushing the claim data back to the EHR. So users can simply utilize our platform to finalize and build all of the coding details. This also eliminates the need for extra code search tools or software licenses. As I mentioned, we do have a comprehensive code set dictionary within our system, and we're automating the processes for navigating to the CD and NCD websites, as well as running the NCCI edit, and in even some cases, providing that modifier suggestion as appropriate. We also enhance the efficiency as the Codio agent continually improves with that machine learning. As I mentioned in the co-pilot phases, there is actual subject matter expertise interaction with the platform, and all of those results build the engine's knowledge of those code selections and increases the chance that those cases will be able to be automated in the future. And then because we're using technology to ingest all of this information, analyze all of the data, and populate the codes, we are able to provide quicker processing of reports, faster turnaround on your coding data, and thereby reducing the time spent on waiting for that reimbursement. Covered a significant amount of information in this time frame. Really wanting to clarify for everyone that medical coding AI agents are an augmentative tool that are able to increase the efficiency in your workforce, are able to augment the practices so that you can have more automation, as well as ensuring the compliance and accuracy of your code selections by giving those audited approvals, as well as applying the guidelines to the coding outputs. And so I'd love to hear now from the audience. We have time for just a few quick questions. If there's anything that lingers in your mind about how artificial intelligence might be appropriate or applicable for your setting. Here. see what we have. See a question here.
Hello. Could I ask a quick question?
Yes, please.
Thank you. I'm wondering about how are you dealing with LLM hallucinations? Because from time to time, LLM can work really well, but from time to time, it just say something uh, wrong, you know.
Sure. So our AI is actually um, built on analysis of the documentation. So we're not actually generating anything outside of what is already found within that operative report or patient record. We have very specific fields that our engine extracts to analyze for this code information. And so that really reduces the chance that it's going to hallucinate or provide information that's not already there. So we go through a pretty detailed extraction process, and then the engine suggestions are, verified over time through the machine learning feedback.
Mm-hmm. Thank you. Do you mean that your agents are not built based on any oh, any LLMs?
Right. We use our own proprietary knowledge base. So we have,
Oh,
our code
okay.
set dictionary built in, and the information is driven by that. Yep.
I see. Thank you.
You're welcome. Question here. Trying to. I think you have the option to unmute yourself. So sorry if you do have a question, please go ahead. Chat. How do we handle regulatory updates? That is an excellent question. So our Medicodio platform is built on Microsoft Azure, which has the high-tech certification. We've also achieved our own security certifications and HIPAA certifications. So we're staying up to date with those regulatory requirements through our internal processes. And then additionally, through licensure with the AMA and collection of data from the CMS website, we are quarterly updating our code sets in alignment with the releases from those organizations. That helps to answer that question.
Can you hear me, Jessica?
Yes, I can. Hello.
Okay, great. I have a question here. How long does it take for a simple medical coder to learn AI? I mean, will he or she be learning machine learning first and then AI, and or what?
So in our platform, there's no specific need to learn artificial intelligence. The AI
Mhm,
agent does the work for them. We're
mhm,
relying on the coder's subject matter expertise to verify the results of that agent. So really the training for a coder user, an individual or provider for our platform is going to be, broken up into training sessions that focus specifically on processes within the platform. We're not changing anything about how they're coding or what codes they would select, based on appropriateness for the record. But they do have to learn to navigate within our platform, to see the code suggestions, to finalize the code details, and then, of course, to make use of the resources and references we have in there in our code set library. Typically for our teams, we recommend a 1 day in-person training during our implementation process. That allows for a person to be on site, feet on the ground, and oversee any, hiccups that might come with the new technology being deployed.
Sure. Yeah.
But otherwise, we can perform these trainings remotely, in 30-minute sessions as needed until the provider has enough confidence and understanding that they're ready to work in the platform on their own.
Okay, right, got it. So do you have any training session expected within a short time?
So for our platform, the training is going to come just for the clients. We don't have a module for individual coders at the moment. We are looking to be integrated in, facilities and practices that might already have existing coding teams or a need to augment their existing coding team. So, it is possible our platform would be a technology that you would encounter, but you would receive the training, from us individually as needed.
Okay, got it. Thank you.
Thank you for your question. What kind of organizations benefit the most from using AI agents? This is an excellent question. Artificial intelligence agents are actually being deployed in all types of healthcare facilities. I'd say right now that a majority of our clients or customers are coming from ambulatory surgery centers. But we also have instances where we're utilized in physician offices, as well as revenue cycle management companies. So individuals that already have existing or large coding teams that have a need, again, to augment their practices or streamline those workflows to ensure accuracy and consistency, can implement our type of technology for their teams to utilize in meeting those goals. Anywhere that there's a high coding volume or staffing challenges, something like an AI Codio agent or Medicodio agent would be a major asset. How does Codio interact with existing billing and claim systems? And so as I mentioned, we're utilizing the RPA and API technology to integrate with the billing systems. And once coders validate those suggested codes, then Codio can send the finalized data directly to the claims and billing platforms. So really, we're kind of a bridge to streamlining the processes. We're pulling the information from the EHR into our engine for analysis. We're providing a platform for the coders to interact with to complete the coding, getting their ICDs, CPTs, HCPCs, and modifiers, and then automating the process for that data to be pushed back into the EHR system, so there's no requirement for manual data entry of the claims information. In some instances, too, we could look at bringing even greater efficiency and automating some of those processes for claim submission. How are AI agents able to adapt to specialty-specific coding needs? So our platform itself is actually specialty agnostic, meaning that we support all medical specialties. And the way that we're able to do that is by having a complete content library and knowledge base. Most of the information is proprietary, but of course, we have our licensure of the CPT sets through the AMA, and then additional sourcing of the code set data from other places. So we do, as I mentioned, our quarterly updates on this information that happens in real time across our platform, ensuring that all of our clients and coder users are getting those updates in real time as well. have anything else coming in. Give everyone just a few moments here. Secure our AI agents in terms of handling PHI? This is an excellent question, something that weighs on all of us as coding individuals. HIPAA compliance, high-tech compliance, SOC 2 security certifications, all of these have been achieved by our organization. But of course, having our own internal reviews, one of my responsibilities at the organization is, of course, to ensure the accuracy of our code data sets and ensure the integrity of all of the transfers. And along with that, we are, of course, encrypting all of our information and managing it with secure infrastructure. Do have about 10 more minutes left in our time today. If anybody else has any additional questions. Otherwise, I will be wrapping up the presentation. We do have all of our contact information here. Please make sure to check out our website, www.medicodio.com. We are also on LinkedIn, Medicodio Inc. And you can also reach out to us with any of your questions, concerns, or if you're interested in scheduling a demo. You can find us at info@medicodio.com, or you can reach out to me personally. I am jessica.miller@medicodio.ai. Again, thank you everyone for your time today. Really appreciate conversation and input, and we look forward to meeting with you again. Thank you.